We're at the world's largest psychiatric conference. 3% of psychiatrists in America are Black. So when we think about if you wanted to see a provider who looks like you, if you're in the Black and brown community, the likelihood of that happening is very, very low.
Well, first of all, thank you so much for joining us today. We really appreciate it.
Thanks for having me.
Yeah, it's our pleasure to be here.
So we're talking about resilience in mental health. What do we mean by resilience in mental health?
I'll say resilience in mental health and stress really relates to the ability to adapt successfully to tragedy, trauma, or significant difficulties, while at the same time being able to maintain your physical or emotional well-being.
I think in my work, I have a family-founded nonprofit, and it was inspired by my brother who had a diagnosis of bipolar pretty young. And for us, we were really navigating a broken system, and we're facing those challenges head on. And so we had to learn resiliency through learning how to adapt with hope and feeling that it was going to be better on the other side. And we learned that really from my brother.
So the other part, in your talk, we're talking about resilience in dynamic times. It reminds me a little bit about the Chinese proverb, may you live in interesting times. But so what do you mean by dynamic times, and why is that important when it comes to resilience?
Yeah, I think these times are so dynamic, especially as it relates to mental health providers and everyone associated with mental health. There's concerns about cuts to Medicaid. There's a lack of access to providers. The uncertainty in the country is at an all-time high. The anxiety rates are at an all-time high. And we know that mental health challenges in youth are at an all-time high. So I think these are some of the dynamic times that we're trying to navigate. And it's really timely that we're talking about resilience given all the challenges that we're facing.
And I think from the patient perspective, it's constantly a changing environment. So when my brother first was going into care, and he's a more severe case, so he would be going through, psychiatric hospitals through long-term residential care. And what that looks like has been changing drastically over the past 15 years too. So for us, it's really trying to stay with the best innovative research that we can stay up to date with, so that we're constantly trying to get the best care for our loved ones.
One of the things you also talk about is care for unrepresented groups. What do you mean by unrepresented groups, and how does resilience affect them?
Well, I think we can just look at certain populations, like in Black and brown communities, that are heavily affected by mental health but aren't getting the same access to treatment. And that was really one of the big inspirations for what we do, was that, and my brother's a Black man, he's now 32, and even with dealing with first responders and how that's different. So for us, the access piece is huge, that it may look different, and when we're talking about traumas, being in the Black and brown community and the trauma that you have, even just wanting to call for help, you already have those barriers to that.
Yeah, and so much of our work is focused on Black and brown communities, and I think the scientific community defines kind of underrepresented as people of color, as Mina mentioned, people with low income, folks who identify as LGBTQ, and people in rural communities. So many people in these groups, especially the intersection of those groups, face huge challenges in access to culturally relevant care and improved treatment outcomes.
And I think the language, which we talked about, and we've been hearing a lot of great panels on it, but that you have to adjust how you talk about mental health, even talking about stigma and what that means. That's different per every group and community that you approach. So you have to be really knowledgeable, or else you're coming in and speaking from your own perspective instead of going in and listening to how they view mental health and what they need.
And just to build on Mina's point, I love this back and forth. To build on Mina's point, I think when we think about the number of Black psychiatrists in the country, we're at the world's largest psychiatric conference. 3% of psychiatrists in America are Black. So when we think about if you wanted to see a provider who looks like you, if you're in the Black and brown community, the likelihood of that happening is very, very low. And so I think one of the big things the APA has been doing is trying to increase access to trainings around cultural humility, as opposed to just saying, well, we're going to send a bunch of psychiatrists into these communities, but really listening to what the communities want and having a posture of cultural humility as we do that.
So my final question is, how do you promote resilience?
Yeah, I'll start at like the community level because so much of our work is entrenched in community. So we've done that a couple ways, really enabling or building upon naturally occurring social support networks.
Okay.
One of the ways we do that is through faith-based organizations, because we know that in many Black and brown communities, people are more likely to get help from a pastor or a faith leader than they are from a mental health professional. And so we are training pastors, we are training church leaders to be able to identify people for depression, provide counseling, and then connect them to mental health professionals. We're also doing that through youth sports to address the crisis of youth suicide. So really leveraging the connectivity of teams, the power of sports as a way to kind of infuse resilience and principles for youth.
Yeah. In preparation for this too, I spoke with my brother, who's the most resilient person that I know, and is the foundation of, why we're even in this and how we continue. And so I was like, what has made you resilient? And I think there's just a few environmental factors. He was an athlete growing up, so speaking to having that team environment. Our family is very close, so we have that family support that even when it's in his darkest times, he knows that we're gonna be there, and no matter, no judgment, no shame. But he said that the hope piece is huge, and how to build hope is leaning into community resources. For him, he's also dual diagnosis, so AA. Belief in a higher power for him has been huge. He says giving back to the community, so even if you're in the throes of getting out of psychosis and feeling kind of hopeless, when he starts interacting with other people and trying to make their life better, that makes him feel, it's like that zoom out approach. And so, yeah, I think for him, that community piece is everything. So you don't feel alone and feel like you're the one squeaky wheel, like you're surrounded by people who are all trying to make it better.
Well, thank you both so much indeed for joining us. I could talk to you all day, but we have to wrap it up there. So thank you very much.
Thank you so much for having us.
Thank you so much.